Hello, I'm Dr. Jordan Smoller, and I'm co-director of the Center for Suicide Research and Prevention at Mass General Brigham and Harvard, and I am glad to have the opportunity to recognize the importance of Suicide Prevention Awareness Month. Over the past 15 years, my research has been dedicated to addressing the problem of suicide and finding new opportunities to improve our ability to prevent suicide and suicide-related behavior. As you may know, suicide is sadly a leading cause of death in this country, and rates have increased by more than 35% over the past 2 decades. And the increase has been even greater among young people, for whom it is now the second leading cause of death. The good news is that researchers, scientists, and healthcare providers around the country are making important advances that we hope can change the outlook for suicide prevention, including by using new technologies and creating partnerships that can reach those who need help when they need it. One of the areas that we have focused on in our research is based on the fact that most people who attempt or die by suicide are seen by a healthcare provider in the prior month. So those of us in healthcare have a crucial opportunity to intervene. But a major challenge is that in order to provide effective prevention, we need to know who may need help, and studies suggest that, like most people, clinicians are not well equipped to predict or know who is really at risk. So one of the key goals of our center is to develop new strategies to improve our ability to identify and support those at risk for self-harm. For example, we've been able to use big data and artificial intelligence to develop tools that clinicians can use to identify patients who are at risk and provide evidence-based support and treatment in clinical practice, especially at high-risk periods, like after somebody is seen in an emergency room or discharged from the hospital. With a dedicated team of researchers and colleagues on the front lines of healthcare, we are working very hard to test and deliver these new strategies. And so as we focus on raising awareness about suicide prevention, our hope is that we can bend the curve of this tragic outcome for patients and families and ultimately save lives.